So excited to present to this group what we're doing here at the University of Utah. And so healthcare as an AI strategy in post-COVID recovery, we've learned so much during COVID, and at the same time have been able to incorporate these lessons learned into our post-COVID recovery strategy. Now let's see if I can. So I'll be talking about, a use case of using AI during COVID, and then how that has shaped, how COVID has shaped our AI strategy post-COVID, specifically similar to my colleague in virtual care, and then a real shift in focus from AI, really trying to understand equity around the use of AI, fairness, explainable AI, so a shift from black box AI to explainable AI, and how that is shaping our governance structures around AI. So AI and COVID-19, we really focused on prediction, and this is an example of our COVID census prediction model dashboard. So during COVID, our Department of Quality, our Quality Department and Department of Public Health faculty members were able to develop a predictive model using our internal data in order to predict what our COVID census and bed utilization needs were going to be. And as you can see from the predicted versus actual, our model was quite accurate, at least accurate enough for us to have really effective planning. And we were never in a situation where our hospital felt completely overrun or under resourced in order to meet the COVID needs of our patient population. So moving forward to AI strategy within virtual care. So during the pandemic, as we all know nationally, there was this huge growth in virtual care. And here at the University of Utah, we went from a few thousand visits to over 400,000 visits in the last year. And so within our virtual care strategic roadmap, we now are reshaping our virtual care strategic roadmap to really be an end-to-end solution for the patient journey, from access all the way, access, treatment to follow-up. And our AI efforts really are focusing on the access piece and our digital front door initiative, including incorporating a vendor solution on smart exams, really being able for the patient asynchronously to be able to utilize a smart exam that's adapted to their personal needs, to be able to tee up that information for our care team to address for that patient. But AI is embedded throughout our end-to-end virtual care strategic roadmap as well. And then when it comes to the explainable or our AI strategy, really focusing on explainable AI, fair AI, and healthcare equity. We're very conscientious of the use of digital and its real risk of increasing health disparities, inequities. Many have referred it to as digital redlining, which is the practice of creating and perpetuating inequities between already marginalized groups, specifically through the use of digital technologies, digital content, and the internet. And we have many examples of AI where that trust really has been eroded. This particular algorithm, race bias in health algorithms, which was an AI algorithm from a big population health vendor, this algorithm estimated that racial bias reduced the number of Black patients identified by extra care by more than half. And the bias occurred because of a labeling error. So when we approach our internally developed AI algorithms, we're really starting to develop this framework of bias and fairness. So how do we ensure that when the algorithm is being created, that there is a pathway for identifying areas where bias can be introduced and really addressing that, so reducing the algorithmic bias, but also an algorithmic fairness. So recognizing that you do need to often, you'll often have conflicting principles around algorithmic accuracy and algorithmic fairness or outcomes. And so being able to have that governance structure in place that says, it's okay to have a little bit of a decreased accuracy if I know that the benefits of the algorithm are going to be equitable across the populations that we serve. And then a shift from black box AI to explainable AI. We're very fortunate to have a very robust Department of Biomedical Informatics that is really on this cutting edge of explainable AI. And so moving away from, it's just not acceptable for our academic community, for our faculty members to accept carte blanche that this AI is going, this algorithm or prediction is going to be that it has value without understanding what are its inputs, its drivers to create that output. And so explainable AI really being able to identify, if not the weights, at least the attributes of the model that are driving that output. And so that is really all that I have today, and that's shaping, these shifts are shaping our AI strategy moving forward, especially around, again, our internally developed, and then how we keep our vendors accountable.